Have you ever wondered what you would do if a stroke struck while you were completely alone, especially after 60? The fear, the uncertainty, the ticking clock, it's a terrifying thought, but you can take control and survive. In this life-changing video, we're diving into the critical steps you need to take immediately to recognize stroke symptoms, act fast, and save your own life when no one else is around. From spotting the warning signs to making split-second decisions, we'll guide you through every heart-pounding moment with clear, actionable advice tailored for seniors living independently. You need to watch this video until the end because these tips could be the difference between life and death, empowering you to face a stroke with confidence and come out stronger. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Number 1. Recognizing the signs and acting immediately. When it comes to surviving a stroke or heart attack, the single most critical factor is recognizing the warning signs and acting without a moment's hesitation. Time is not just a factor, it's the defining element. Every second that passes without intervention increases the risk of irreversible damage to your brain or heart tissue. For seniors, who may be more vulnerable due to age-related health changes, this urgency is even more pronounced. Many seniors dismiss early symptoms, mistaking them for something benign like indigestion, fatigue, or even a pulled muscle. This hesitation can lead to catastrophic delays, costing precious minutes or even hours when timely action could have saved a life or preserved quality of life. Consider the story of James, a 73-year-old retired teacher from Ohio. One quiet morning, while sipping coffee and reading his newspaper, he suddenly felt a tingling numbness in his face and a heavy weakness in his left arm. Instead of brushing it off as a fleeting issue, James trusted his instincts. He remembered a community health seminar where he'd learned the signs of a stroke. Without delay, he dialed 911 and calmly described his symptoms. Paramedics arrived within 10 minutes, and because of his swift action, James received clot-busting medication at the hospital within the critical golden hour, leading to a near-full recovery. Why is recognizing symptoms so vital? Strokes and heart attacks are medical emergencies that disrupt blood flow, starving the brain or heart of oxygen. A stroke, often caused by a clot or bleed in the brain, can manifest as sudden confusion, trouble speaking or understanding speech, numbness or weakness, especially on one side of the body, vision problems in one or both eyes, difficulty walking, or a severe headache with no apparent cause. A heart attack, typically triggered by a blocked coronary artery, may present as chest pain or discomfort, which can feel like pressure, squeezing, or fullness, pain radiating to the arms, jaw, neck, or back, shortness of breath, cold sweats, nausea, or sudden dizziness. These symptoms can vary widely. Some people experience intense pain, while others, especially women or seniors, may have subtler signs like fatigue or mild discomfort. Unfortunately, many seniors delay seeking help due to fear, denial, or embarrassment about making a fuss. This hesitation is dangerous. Data from the American Heart Association shows that the average delay in seeking treatment for a heart attack is about 3 hours, and for strokes, it can be even longer. Yet, treatments like thrombolytics for strokes or angioplasty for heart attacks are most effective when administered within the first few hours, often within 60 to 90 minutes for strokes and up to 120 minutes for heart attacks. From a psychological perspective, fear and denial are natural responses during a medical crisis. The brain may try to rationalize symptoms, hoping they'll pass. But this hope can be deadly. Overcoming this requires a mindset shift. Trusting your body's signals and acting decisively is an act of self-respect and empowerment. Seniors living alone, in particular, need to cultivate this survival mindset. It's not about living in fear, but about being prepared to act with confidence. Actionable steps for recognizing and acting on symptoms. 1. Educate yourself thoroughly. Familiarize yourself with the acronym FAST for strokes. Face drooping, arm weakness, speech difficulty, time to call 911. For heart attacks, memorize key signs: chest discomfort, shortness of breath, and radiating pain. Print out a symptom checklist and keep it visible at home. 2. Keep emergency numbers accessible. Program 911 and a trusted contact into your phone's speed dial. Post emergency numbers on your fridge or near your phone. 3. Consider a medical alert device. wearable devices, like Life Alert or Medical Guardian, can summon help with the press of a button, especially useful for seniors living alone. 4. Practice mental preparedness. Visualize how you'd respond to symptoms. Mentally rehearse calling 911 and describing your symptoms clearly to reduce panic in the moment. 5. Talk to your doctor. Discuss your personal risk factors, e.g., high blood pressure, diabetes, or prior heart issues, and ask about subtle symptoms you might overlook. By internalizing these steps, you're not just gaining knowledge. You're building a proactive, life-saving mindset. The difference between acting at the first sign and waiting can mean the difference between a full recovery and permanent disability, or worse. James's story is a testament to this. His quick thinking preserved his ability to enjoy his retirement, from gardening to spending time with his grandchildren. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 2. The power of self-help techniques when alone. Facing a stroke or heart attack alone can feel overwhelming, especially for seniors who may live independently. The sense of isolation can amplify panic, but you are far from powerless. There are practical, evidence-based self-help techniques that can stabilize your condition and buy critical time until emergency responders arrive. These techniques, when practiced and understood, can transform fear into action and helplessness into hope. One of the most effective self-help methods is cough CPR, a technique that can help maintain blood flow and oxygen circulation during a heart attack. Let's look at the story of Helen, a 78-year-old grandmother from Florida. One afternoon, while gardening in her backyard, Helen felt a sudden, crushing pain in her chest and began to sweat profusely. Alone and miles from the nearest neighbor, she recalled a health seminar where she'd learned about cough CPR. She immediately sat down, dialed 911, and began coughing forcefully every 2 to 3 seconds. This rhythmic coughing kept her heart pumping and her brain oxygenated, preventing her from losing consciousness until paramedics arrived 15 minutes later. Helen's quick action likely saved her life, allowing her to recover and continue enjoying her hobbies and family. How does cough CPR work? When you cough forcefully, you compress your chest, which squeezes the heart and forces blood to circulate, mimicking the effects of traditional CPR. This can be critical during a heart attack, especially if you're experiencing an arrhythmia, irregular heartbeat, that disrupts blood flow. While cough CPR isn't a substitute for professional medical care, it can serve as a temporary measure to stabilize you. Important note, cough CPR should only be attempted if you're experiencing heart attack symptoms and have been advised by a medical professional about its use. It's not universally recommended and may not be effective for all situations, so consult your doctor beforehand. In addition to cough CPR, controlled breathing exercises can help manage panic and improve oxygen levels during a crisis. Deep, slow breaths, inhaling for 4 seconds, holding for 4, and exhaling for 4, can calm your nervous system, lower your heart rate, and ensure your brain and heart receive adequate oxygen. This is particularly helpful during a heart attack, when panic can exacerbate symptoms, or during a stroke, when oxygen delivery to the brain is critical. Another practical technique is positioning your body correctly. If you suspect a heart attack, sit down or lie back with your head elevated to reduce strain on your heart. Avoid standing or walking, as this can increase the heart's workload. For a suspected stroke, lie flat with your head slightly elevated to promote blood flow to the brain, unless you're experiencing vomiting, in which case lie on your side to prevent choking. Why do these techniques matter? They empower you to take control in a crisis, especially when alone. Many seniors hesitate to act because they fear doing the wrong thing or worsening their condition. However, the risk of inaction far outweighs the risk of trying. Practicing these techniques in advance builds muscle memory and confidence, reducing fear and hesitation in the moment. For example, Helen had practiced deep breathing exercises as part of her yoga routine, which helped her stay calm during her heart attack. She also kept her phone within reach, a habit she developed after learning about emergency preparedness. Actionable steps for mastering self-help techniques. 1. Learn cough CPR properly. Consult your doctor or a certified CPR instructor to understand when and how to use cough CPR. Practice the rhythm of forceful coughing every 2 to 3 seconds during a low-stakes setting to build familiarity. 2. Practice breathing exercises. Incorporate deep breathing into your daily routine, such as during meditation or before bed. This builds a habit you can rely on during a crisis. 3. Prepare your environment. Keep a phone, medical alert device, or emergency whistle within arm's reach at all times, especially in areas where you spend the most time, e.g., bedroom, living room. 4. Simulate emergencies. Conduct mental or physical rehearsals of what you do during a heart attack or stroke. For example, practice dialing 911, describing symptoms, and performing cough CPR or breathing exercises. 5. Stay informed. Attend community health workshops or watch credible online tutorials from organizations like the American Heart Association to reinforce your knowledge. Helen's story illustrates the power of preparation. By staying calm, using cough CPR, and calling for help, she turned a life-threatening situation into a manageable one. These self-help techniques aren't about becoming a medical expert. They're about equipping yourself with simple, effective tools to protect your life when seconds count. Number 3. The critical role of recognizing early warning signs. One of the greatest challenges seniors face during a heart attack or stroke, especially when alone, is recognizing the early warning signs quickly and accurately. Subtle symptoms are often dismissed as just aging, overexertion, or a minor ailment like indigestion or arthritis. However, this delay can be deadly. Understanding what to look for, trusting your instincts, and acting decisively can mean the difference between life and death or between recovery and long-term disability. Consider the story of Carl, a 75-year-old retired schoolteacher from Texas. One quiet morning, while preparing breakfast, Carl noticed a mild tightness in his chest and a slight dizziness that felt off. Instead of attributing it to his recent yard work or lack of sleep, he recalled a conversation with his doctor about heart attack symptoms. Carl sat down, focused on slow breathing to stay calm, and called 911 immediately. His quick recognition and response led to a stent procedure within hours, and he made a full recovery, returning to his active lifestyle of volunteering and hiking. What are the early warning signs? For a heart attack, symptoms often include chest discomfort, pressure, squeezing, fullness or pain that lasts more than a few minutes or comes and goes. Pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath, with or without chest discomfort. Cold sweats, nausea, vomiting, or lightheadedness. Unusual fatigue, especially in women or older adults. For a stroke, look for sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Sudden vision problems in one or both eyes. Sudden difficulty walking, dizziness, or loss of balance. A sudden, severe headache with no known cause. These symptoms can be fleeting or mild, especially in seniors, who may have atypical presentations. For example, women and older adults may experience heart attack symptoms like nausea or fatigue rather than classic chest pain. Similarly, strokes in seniors may start with subtle confusion or slight weakness rather than dramatic paralysis. This is why education is critical. According to the CDC, only about 50% of Americans can identify the major signs of a stroke, and even fewer recognize atypical symptoms. Why is early recognition so challenging? Many seniors live with chronic conditions like arthritis, high blood pressure, or digestive issues, which can mask or mimic emergency symptoms. For instance, chest discomfort might be mistaken for acid reflux, or arm weakness might be attributed to a previous injury. Psychological barriers also play a role. Denial, it's probably nothing, or fear of bothering emergency services can lead to hesitation. Yet, every minute counts. For strokes, brain cells die at a rate of 1.9 million per minute during a blockage, and for heart attacks, heart muscle damage progresses rapidly without oxygen. Carl's story highlights the power of awareness. His regular checkups and discussions with his doctor about his heart disease risk, due to a family history, gave him the confidence to recognize unusual symptoms. When the tightness and dizziness hit, he didn't second-guess himself. He acted, and that action saved his life. How can you improve early recognition? It starts with education and self-awareness. Regular health checkups can help you understand your baseline health and risk factors, such as high cholesterol, hypertension, or atrial fibrillation. Keeping a symptom journal, tracking when you feel off, and what those sensations entail, can help you distinguish normal aches from red flags. Sharing this knowledge with friends, family, or caregivers is also crucial. If you're unable to call for help, someone familiar with your health history might notice subtle changes and act on your behalf. Actionable steps for recognizing early warning signs. 1. Learn the symptoms. Study the signs of heart attacks and strokes using reliable sources like the American Heart Association or National Stroke Association. Create a wallet-sized card with symptoms for quick reference. 2. Know your body. Track your normal health patterns, e.g., energy levels, chronic pain, to better identify abnormalities. Discuss these with your doctor to understand your unique risk profile. 3. Educate your circle. Teach family, friends, or neighbors about stroke and heart attack signs so they can act if they notice something wrong. 4. Trust your instincts. If something feels off, don't wait for symptoms to worsen. Call 911 and describe your symptoms clearly, even if they seem mild. 5. Prepare for action. Keep a phone or medical alert device nearby, and practice how you describe symptoms to a dispatcher, e.g., "I'm feeling chest pressure and dizziness." Carl's swift response, sitting down, breathing steadily, and calling 911, demonstrates the power of preparation. He didn't let fear or embarrassment stop him, and neither should you. Seniors often worry about being a burden, but when it comes to strokes or heart attacks, every second counts. Your life is worth any temporary inconvenience. Number 4. The life-saving power of the right positioning and breathing techniques. When a heart attack or stroke strikes and you find yourself alone, the immediate actions you take can significantly impact your chances of survival and recovery. Beyond simply waiting for emergency services to arrive, how you position your body and manage your breathing can alleviate symptoms, enhance oxygen flow, and reduce the strain on critical organs like your heart and brain. For seniors, who may face a higher risk of such emergencies due to age-related health conditions, mastering these techniques is not just helpful, it's potentially life-saving. These strategies are simple yet powerful, offering practical tools to stabilize your condition until professional help arrives. To illustrate their importance, let's explore the story of Helen, a 78-year-old woman whose quick thinking during a medical emergency made all the difference. Helen's story. A real-life example. Helen was alone at home when she suddenly experienced a mild stroke. She noticed alarming symptoms: weakness on one side of her body, dizziness, and difficulty speaking clearly. Panic began to set in, but Helen recalled a critical piece of advice from a community health seminar she had attended. Instead of succumbing to fear, she took immediate action. She carefully sat down on a chair, leaned slightly forward with her elbows resting on her knees to support her posture, and began focusing on slow, controlled breathing. By inhaling deeply through her nose, holding for a few seconds, and exhaling gently through pursed lips, she was able to stabilize her breathing, reduce her dizziness, and maintain a sense of calm. This allowed her to stay composed long enough to call 911 and communicate her symptoms clearly to the dispatcher. When paramedics arrived, they credited her calm demeanor and proper positioning with helping to prevent her condition from worsening. Helen's story underscores the profound impact of preparation and knowledge. By applying techniques she had learned, she not only managed her symptoms effectively but also bought critical time until help arrived. Her experience is a testament to why every senior should be equipped with these skills and practice them regularly. Why positioning matters. Proper body positioning during a heart attack or stroke can significantly influence how your body copes with the emergency. The goal is to reduce strain on the heart and lungs, optimize oxygen delivery, and prevent complications like falls or worsening symptoms. Here's why specific positions are recommended. Sitting upright or slightly forward. For a suspected heart attack or stroke, sitting upright or leaning slightly forward with support, e.g., elbows on knees or a table, can alleviate pressure on the chest and diaphragm. This position facilitates easier breathing, reduces the workload on the heart, and helps maintain blood flow to vital organs. For example, during a heart attack, this posture can lessen the strain on the heart muscle, which is already under stress due to reduced blood flow. Avoid lying flat. Lying flat on your back, especially during a heart attack, can exacerbate shortness of breath or increase pressure on the lungs, making it harder to breathe. For stroke patients, lying flat may also increase intracranial pressure, potentially worsening neurological symptoms. However, if you feel faint or are at risk of falling, lying down on your side, preferably the recovery position, can prevent injury while still allowing for adequate breathing. Preventing falls. Dizziness and lightheadedness are common during cardiovascular or neurological emergencies. If you feel unsteady, sitting or lying down immediately can prevent a fall, which could lead to additional injuries like fractures or head trauma. Particularly dangerous for seniors with fragile bones or those on blood thinners. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. The role of breathing techniques. Controlled breathing is a cornerstone of managing a medical emergency. It serves multiple purposes. It ensures adequate oxygen supply, calms the nervous system, and reduces the psychological stress that often accompanies a heart attack or stroke. Here's how it works. Optimizing oxygen levels. During a heart attack, the heart struggles to pump oxygen-rich blood effectively, and during a stroke, brain cells may be deprived of oxygen due to a blocked or ruptured blood vessel. Slow, deep breathing helps maximize oxygen intake, ensuring that the body's vital organs receive as much oxygen as possible under the circumstances. Reducing panic and heart rate. Panic is a natural response to a medical emergency, but it can worsen symptoms by increasing heart rate and blood pressure, which places additional strain on an already compromised cardiovascular system. Techniques like diaphragmatic breathing, breathing deeply from the belly, or pursed lip breathing, inhaling through the nose and exhaling slowly through pursed lips, activate the parasympathetic nervous system, promoting relaxation and lowering heart rate. Helen's breathing technique. Helen used a specific method, inhaling slowly through her nose for a count of 4, holding her breath for a count of 2, and exhaling gently through pursed lips for a count of 6. This technique, often recommended for managing anxiety or respiratory distress, helped her maintain composure and ensured her brain and heart received adequate oxygen during her stroke. Psychological benefits. The psychological impact of a heart attack or stroke cannot be overstated. Fear, confusion, and a sense of helplessness can cloud judgment and lead to poor decision-making, such as delaying a call for help or attempting to move unnecessarily. By focusing on controlled breathing and proper positioning, you create a sense of agency and calm. This mental clarity enables you to take practical steps, such as calling emergency services, unlocking the door for paramedics, or alerting a neighbor. Practicing these techniques regularly can make them second nature, so you're prepared to act instinctively during a crisis. Practical steps for preparation. To make these techniques effective, seniors should incorporate them into their daily routines and emergency preparedness plans. 1. Practice breathing exercises. Dedicate a few minutes each day to practicing deep breathing or pursed lip breathing. This builds muscle memory, so the technique feels natural during an emergency. For example, try inhaling for 4 seconds, holding for 2, and exhaling for 6, repeating for 5 to 10 cycles. 2. Simulate emergency scenarios. Practice sitting in the recommended position, upright or slightly forward, and combining it with controlled breathing. Familiarity with these actions reduces hesitation in a real emergency. 3. Keep a phone accessible. Always have a phone within reach, ideally with emergency numbers programmed into speed dial. Wearable medical alert devices can also be lifesavers for seniors living alone. 4. Educate yourself. Attend community health seminars, watch educational videos, or consult with healthcare providers to learn more about emergency response techniques. Knowledge is empowerment. Complementary actions. In addition to positioning and breathing, other immediate actions can enhance survival odds. For example, if you suspect a heart attack and have been prescribed nitroglycerin, take it as directed while waiting for help. Avoid eating or drinking anything, except water if necessary, until medical professionals advise otherwise, as this could complicate treatment. If you're alone, try to unlock your door or alert a neighbor to ensure paramedics can access you quickly. Why it matters. The combination of proper positioning, controlled breathing, and prompt communication can stabilize your condition, reduce complications, and buy critical time until medical help arrives. These techniques are not a substitute for professional care but serve as vital first steps to support your body during the critical early moments of a heart attack or stroke. By preparing in advance and staying calm, you empower yourself to face even the most frightening emergencies with confidence. Number 5. The critical importance of recognizing early warning signs and acting fast. When a heart attack or stroke occurs, every second counts. For seniors, who may be more vulnerable to these conditions due to age-related changes in the cardiovascular and neurological systems. Recognizing early warning signs and acting immediately can mean the difference between life and death, or between a full recovery and long-term disability. Delaying action, even for a few minutes, can lead to irreversible damage to the heart or brain. To highlight the importance of this knowledge, let's look at the story of Robert, a 72-year-old retiree whose quick response to subtle symptoms saved his life. Robert's story. The power of prompt action. One morning, Robert was alone at home when he began to feel unusually fatigued. He noticed a mild, persistent discomfort in his chest, which he initially thought might be indigestion. However, having attended a heart health workshop, Robert recognized that these could be early signs of a heart attack. Instead of dismissing the symptoms or waiting to see if they would pass, he immediately called 911. He described his symptoms clearly to the dispatcher, who sent paramedics promptly. At the hospital, doctors confirmed he was experiencing a heart attack and administered treatment within the critical first hour, minimizing damage to his heart muscle. Robert's swift action and awareness of warning signs were pivotal in his survival and recovery. Recognizing the warning signs. Heart attacks and strokes present with distinct but sometimes subtle symptoms, and seniors may mistake these for less serious conditions, such as fatigue, indigestion, or muscle aches. Understanding the specific signs is crucial for timely action. Here's what to look for. Heart attack symptoms. Chest pain or pressure, a feeling of squeezing, tightness, or heaviness in the chest, which may come and go or persist. It may feel like a heavy weight or burning sensation. Shortness of breath, difficulty breathing, often accompanying chest discomfort. Radiating pain, discomfort spreading to the arms, especially the left arm, neck, jaw, back, or stomach. Nausea or vomiting, particularly common in women, this may feel like indigestion. Lightheadedness or dizziness, a sense of fainting or unsteadiness. Cold sweats, sudden, clammy sweating unrelated to physical exertion. Fatigue, unexplained, extreme tiredness, especially in women. Stroke symptoms, remember the acronym FAST. Face drooping, one side of the face feels numb or droops when smiling. Arm weakness, one arm feels weak or numb and may drift downward when raised. Speech difficulty, slurred speech, difficulty speaking, or trouble understanding others. Time to call 911. If any of these signs are present, call emergency services immediately. Additional stroke symptoms, sudden confusion, vision problems in one or both eyes, trouble walking, loss of balance or coordination, or a severe headache with no known cause. Why early recognition is critical. The urgency of recognizing these symptoms lies in the time-sensitive nature of treatment. Heart attacks. During a heart attack, a blocked coronary artery deprives the heart muscle of oxygen, leading to tissue damage. Treatments like angioplasty, to open the blocked artery, or medications like aspirin or nitroglycerin are most effective when administered within the first hour, often referred to as the golden hour. Every minute of delay increases the extent of heart damage, raising the risk of heart failure or death. Strokes. For ischemic strokes, caused by a blood clot, clot-busting drugs like tissue plasminogen activator, TPA, must be given within 3 to 4.5 hours of symptom onset to be effective. For hemorrhagic strokes, caused by bleeding, surgical intervention may be needed urgently. Delayed treatment can lead to permanent brain damage, affecting speech, movement, or cognition. Challenges for seniors. Seniors face unique challenges in recognizing and responding to these symptoms. Age-related changes, such as reduced pain sensitivity or chronic conditions like arthritis, may mask or mimic heart attack or stroke symptoms. For example, chest pain might be attributed to a muscle strain, or fatigue might be dismissed as a normal part of aging. Additionally, fear of bothering others or denial that a serious problem exists can delay action. Overcoming these barriers requires education and a proactive mindset. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Practical steps for acting fast. To ensure a swift response, seniors living alone should adopt the following strategies. 1. Know the symptoms. Memorize the signs of a heart attack and stroke, and take all symptoms seriously, even if they seem mild or vague. When in doubt, it's better to err on the side of caution. 2. Have a plan. Keep a phone within reach at all times, with emergency numbers, 911, a trusted neighbor, or family member programmed for quick access. Consider investing in a medical alert system that allows you to call for help with the press of a button. 3. Communicate clearly. If you call 911, clearly state your symptoms, location, and any relevant medical history, e.g., I have chest pain and a history of high blood pressure. Unlock your door if possible to ensure paramedics can enter quickly. 4. Educate others. Share your knowledge of warning signs with family, friends, or neighbors. They can assist in recognizing symptoms or calling for help if you're unable to act. 5. Regular health checkups. Routine medical evaluations can identify risk factors like high blood pressure, cholesterol, or atrial fibrillation, allowing for preventive measures that reduce the likelihood of a heart attack or stroke. Overcoming psychological barriers. Fear, embarrassment, or denial often prevent people from seeking help promptly. Seniors may worry about causing a fuss, or feel reluctant to burden others. However, seeking help is a sign of strength, not weakness. Educational programs, support groups, and open discussions with healthcare providers can help normalize the importance of acting quickly. Practicing how to respond in an emergency, through role-playing or mental rehearsal, can also reduce hesitation. The impact of quick action. Robert's story illustrates the life-saving power of early recognition and prompt action. By calling 911 immediately, he ensured that doctors could intervene before significant heart damage occurred. Studies show that patients who receive treatment within the first hour of a heart attack or stroke have significantly better outcomes, including lower rates of disability and mortality. For seniors, who may have less physiological reserve to withstand prolonged oxygen deprivation, this window is even more critical. Empowering yourself. Ultimately, recognizing early warning signs and acting fast is about taking control of your health. By staying informed, preparing in advance, and overcoming psychological barriers, you can significantly improve your chances of surviving a heart attack or stroke. Combine this knowledge with the positioning and breathing techniques discussed earlier, and you have a powerful set of tools to manage emergencies effectively. That's it for our life-saving guide on surviving a stroke alone after 60. Now, we want to hear from you. What's one key thing you've learned from this video that you'll put into practice to stay prepared and protect yourself? Drop it in the comments below and let's inspire each other to stay proactive about our health. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more empowering health tips to keep you safe and thriving.